How does post-op monitoring prevent plastic surgery infections? Imagine going through a plastic surgery procedure and then feeling confident that your recovery is being carefully watched. Post-op monitoring is a vital part of ensuring your safety after surgery. It helps catch infections early before they become serious problems. Surgical site infections are infections that happen near the incision within 30 days of surgery. They can cause redness, swelling, pain, warmth, or pus from the wound. Sometimes they can lead to longer recovery times and higher medical costs. That's why close monitoring after surgery is so important. Before you leave the hospital or clinic, your surgical team will give you clear instructions. They will tell you how to care for your incision, what signs to watch for, and when to seek help. For example, if you notice increased redness, swelling, or pus, or if you develop a fever or feel generally unwell, you should contact your doctor. Regular follow-up appointments are scheduled to check your healing process. During these visits, your surgeon will examine your wound for any signs of infection or abnormal healing. Early detection of small issues like mild redness or swelling can prevent them from turning into more serious infections. In some cases, your doctor might take a small sample from your wound to identify bacteria. This helps determine the best antibiotic treatment if needed. Post-op monitoring also encourages you to follow wound care instructions carefully. Keeping the incision clean and dry, avoiding strenuous activities, and taking prescribed antibiotics are all key steps. Your healthcare team will remind you to maintain good nutrition, stay hydrated, and avoid smoking, as these factors influence healing and infection risk. Medical guidelines from health authorities emphasize controlling body temperature and blood sugar levels during recovery because both can affect infection chances. When implants or foreign materials are involved, the risk of infection can be higher. In such cases, additional tests or imaging might be recommended to ensure everything is healing well. To make monitoring easier, many clinics offer structured check-in schedules, access to support lines, and even telemedicine options for remote assessments. These tools help ensure you get professional advice quickly if any concerns arise. While post-op monitoring greatly reduces the risk of infection, it cannot eliminate it entirely. Factors like your overall health, surgical technique, and how well you follow care instructions all play a role. That's why it's essential to stay engaged with your healthcare team and report any concerns promptly. Remember, this ongoing care is part of a comprehensive approach that includes proper surgical techniques, sterile procedures, and appropriate use of antibiotics. In the end, consistent post-op monitoring helps catch problems early, supports proper wound healing, and keeps you safe during your recovery. Always follow your surgeon's advice and reach out if anything feels unusual. Your health and safety depend on it.